In a very short period of time, human health and well-being have changed dramatically. 100 years ago, fewer than 4% of Americans were obese. Today, that number is 40%, a tenfold increase. 20% of adolescents are now obese. Around 50% of Americans have diabetes or prediabetes. Yet little progress has been made in reversing these trends. At Idaho Bariatric and Metabolic Institute, we are focused on understanding the causes of obesity and diabetes and related diseases. It is only through understanding the cause that the solution can be found. Diet, exercise, and lifestyle changes result in long-term weight loss in only 5% of individuals. On the other hand, with long-term follow-up, bariatric surgery results in success 70% of the time. This dramatic difference in success with these approaches offers us key insights into both cause and cure. Join us as we look deeper into this epidemic that is causing widespread pain and suffering in our generation. We are all familiar with the problem of obesity in America. We seem to be gaining weight without any definitive answers in sight. We are told to eat less and move more. Constant battles rage between various groups, arguing that their diet and approach to nutrition is the answer. But nothing appears to be changing. Many people succeed in losing weight only to regain the weight months or years later. And with this cycle come feelings of discouragement and failure. So many people feel hopeless in their personal battle to overcome weight problems. They are told by society and experts that they have not done enough to fix their problem. They are to blame. With time, they feel a growing sense that it defines who they are and feels more and more like a prison. The cause of obesity is far more complex than we have understood. It is not just eating too much food that leads to obesity and chronic disease. The path includes stress, shame, problems with sleep, feelings of isolation and detachment, fear, and an unreliable and ever-changing stream of information telling us what to eat and what not to eat. The problem is as closely related to our nervous system and emotions as it is to anything else. Bariatric surgery is currently the most effective treatment for obesity and diabetes. Let's look at the two most commonly performed bariatric procedures and see how they work. The laparoscopic sleeve gastrectomy is the most commonly performed operation to treat obesity both in America and in the world. It is done through 3 or 4 small incisions using a camera. After freeing up the stomach from some of its attachments, a stapling device is used to remove about 80% of the stomach. When this is completed, the person's stomach is in the shape of a tube or shirt sleeve, which is where the operation gets its name. The laparoscopic Roux-en-Y gastric bypass usually takes about 2 hours to perform. It is a bit more complicated and requires more steps to complete. But think of it in terms of 2 main parts. One part is detaching the upper portion of the stomach from the rest of the stomach. This upper portion is called the gastric pouch or stomach pouch. That small pouch will fit about an egg's worth of food inside. The second part of the operation involves dividing the small intestine and rerouting the upper intestines. One segment of the small intestine is brought up and attached to the stomach pouch that was previously created. Another segment of small intestine is attached to the lower segment of intestine, allowing for intermixing of the food that is eaten in the digestive juices made by the body. The stay in the hospital after these procedures is 1 night. The focus in the early period after the operation is walking and sipping liquids. It is very important to us that a person understands these operations and the risks associated with them. During the first 3 weeks after surgery, a person's diet consists of liquids, including protein shakes. Bariatric vitamins are taken starting 2 to 4 days after surgery. After 3 weeks of a liquid diet, the person advances to a 3-week diet of clear liquids and soft foods high in protein. 1 out of 3 of our patients has diabetes. 90% of these diabetic patients are off of all their diabetes medications within a relatively short time after the operation. 80 to 90% of people who start out on medications for blood pressure are off of those medications within 3 months after their operation. We also see dramatic improvements in obstructive sleep apnea, polycystic ovarian syndrome, high cholesterol, heartburn, and joint pain. So, although we are very interested in weight, there are many problems we seek to improve or cure. Now, how do these bariatric operations work? Why are they effective in treating obesity and related problems? It is very often stated that these operations work by restricting how much a person can eat. But this limited understanding is missing the mark and can lead a person to overlook what is required to be successful. This restriction idea leads to the false perception that it is the new anatomy that fixes the problem, and that isn't necessarily true. To optimize the effects of these operations, we must understand how they really work. The result of these operations are more a consequence of changes in the nervous system than anything else. Both of these operations change the levels of several hormones in a person's body in a way that is very favorable for weight, metabolism, and brain function. These changes in hormone levels occur very quickly, sometimes within a day or two of the procedure. And this, in part, explains some of the positive results of bariatric surgery. But the most powerful tool provided by bariatric surgery may be how these operations affect the nervous system and brain. But how can that be since these operations only involve altering the anatomy of the stomach and intestines? The brain and digestive system are closely linked in a very important relationship. The brain influences how food is digested, and the digestive tract can dramatically influence the brain. These two systems, brain and gut, communicate with each other constantly through nerves and hormones, and bariatric surgery changes both of these important lines of communication. The hormones that are changed shortly after these operations cross the blood brain barrier and alter the neurochemistry of the brain. This change in chemistry in the brain results in people not feeling hungry very often or very intensely. It improves insulin sensitivity and cravings, and it helps with how food is processed. Many people say their sense of taste and smell is different after the operation. Protein shakes that are delicious before surgery often taste too sweet after the operation. Maybe the most obvious change people notice is how much they can drink or eat. It takes only a very small amount of liquid or solid food to make a person feel full and even uncomfortable. In short, there is a flood of new feedback from the body after surgery. And the key is to translate all of this new sensory information into changes within the brain and body that are permanent. Explained another way, bariatric surgery produces a window of time when there is heightened neuroplasticity. Neuroplasticity refers to the brain's ability to change function, organization, and even structure. This gives us an enormous opportunity to reset our weight, metabolism, and so many things related to food. If this period of time passes without a person knowing what is actually going on, the greatest opportunity and effect of bariatric surgery can be lost. If a person does not listen to the feedback from their body after surgery, that feedback will eventually go away, and that can lead the patient back to where she started. To effectively rewrite the programs in the brain, as well as reset metabolism after bariatric surgery, a person must eat the right food at the right time and in the right way. Eating the wrong foods or ignoring signals from the body can quite easily disrupt this process of change in one's brain. Cognitive exercises, including mindfulness techniques, support this neuroplasticity and improve stress levels. Maybe most importantly, we can use these tools after surgery to alter drastically how a person feels about themselves. Sleep is also a crucial factor in making these changes in the brain permanent, and we employ many strategies and technologies to help our patients sleep effectively. The greater the number of tools employed to optimize bariatric surgery, the greater the chances for long-term success. We continue to see our patients every month for at least a full year after their operation to see this journey through. But it doesn't end there. We continue to see our patients indefinitely as frequently as is needed to ensure their success. Albert Einstein stated that all religions, arts, and sciences are branches of the same tree. All these aspirations are directed toward ennobling man's life, lifting it from the sphere of mere physical existence and leading the individual towards freedom. At Idaho Bariatric and Metabolic Institute, our mission is to help people live longer, achieve their greatest potential in health and mental clarity. Ultimately, it is about being with those people you love and having the life you desire.